whole issue of how to partnership and how to reach to the community. I think that's one thing where, let's say, when you work in an area, it's also all about getting faith of the community that you work with. Recently, there have been enough examples. I'm not going to the details now, where corporates also looking to work with the community, and that's where working with community, working for their needs, which is health, education, works very well. I like to call Praveen. Praveen is a health specialist. He has been working with this company for long now, and he looks after sales. And they have this whole concept of having ambulances, providing them at a very reasonable rate, and how they work. Let's know about that, Praveen.
Dr. Upadhyay, panelists, my dear friends. In the morning, we heard from Dr. Bhaskar Chatterjee, and also from Carol today, that corporates working in the social space are also allowed to have profits. Because today we have a distinguished gathering of NGOs who are doing sterling work in the areas of healthcare and other activities. I represent Ziqitza Healthcare, an organization which was started around 10 years ago. The founders of this organization were, people in the corporate space working in the US, having education and working in there. But they realized that there was a need in the pre-hospital space, and that's what got them together, and they started this organization Ziqitza at that time as an NGO. So it was you avail of the service and pay what you want. People who cannot afford to pay get the service free of cost. But very soon they realized that, if you want to have an organization which is working in the social space, you need to be sustainable. And that's where various models of ambulatory services, both in the public and in the private space, emerged. Healthcare delivery system, as we know of it today, has evolved over the years. And we at Ziqitza work with the government as a public-private partner. We work in 4 states. We impact lives. An example of this, although being a corporate, was demonstrated in the form of the Times of India Social Impact Award earlier this year from the President of India. We impact nearly 20 lakh people since the time we started, and we've delivered around 7,000 babies in the ambulance. And today, the government has recognized deliveries in ambulance as an institutional delivery. So we have upgraded the skills of the medics who are working in the ambulance. We've made pregnancy kits because we are aware of the challenges which are faced in the rural areas with pregnant women, because everything happens last minute, and it's by the time they reach the hospital, the baby is already delivered on the way. We delivered a breech baby earlier this year through online medical direction from our call center. So that's one of the highlights that we had in the organization, because it was a very difficult and a dangerous procedure. We also work in the private space by providing ambulances at a very reasonable price. Yes, Dr. Upadhyay, we do provide that. But how do we do it? We have like-minded corporates, we have insurance partners who help us by providing branding opportunities on the ambulances or the vehicles that we have, and that money which comes in helps us to subsidize the calls. So a person who goes into a private hospital pays the full fare, pays the full tariff. A person who goes to a government hospital pays a discounted fare, and the person below the poverty line gets the service free of cost. The service that we provide to all 3 categories is absolutely the same. And we're working in different geographies today in India. We want to expand this model. We want to reach out to a large number of people, and that's why I think this forum is so very important, because there are like-minded corporates out there who want to reach out to different communities, be it in the urban or the rural areas, wherein we can provide pre-hospital care to people who need it. The third option that we have is providing ambulatory services to large corporates, to the communities that they work in. We also provide services in the form of mobile medical vans. We have outreach programs to educate the ASHA workers. We have programs to sensitize the local communities. We have health camps at various schools, colleges, and different communities. We also have something like the training programs that we have, like the first responder programs or the health camps that we have. And these are also outreach programs for the communities that we work in, along with the corporates. You have to pardon me if this sounds like a sales pitch, but we treat this as a social responsibility. We work in the social space, but we are a profit-making organization. And very soon, I think, once we reach that 5 crore figure of profitability, we will have to also demonstrate CSR from our end. I think this conference, arranged by NGO Box is very interesting, and the format that we are working in today will have to undergo a sea change. With the funding which is coming in from the corporates, there will need to be structured players in various space, in various domains across the healthcare delivery system, and that's going to be evolved over the next few years. Thank you, ladies and gentlemen.
Sustainability. Any operation